Hey everybody, this is Joshua with the Tendonitis Expert. And this video is about why carpal tunnel surgery might just be a bad idea. So if you are considering getting carpal tunnel surgery, chances are it's because of three factors. One is you've been hurting for a long time. The pain and symptoms are bad enough, and they've been bad enough for long enough that it drives you to action and maybe even a little desperation. And the third is that everything else that the doctors had you try has failed. So you say yes to carpal tunnel surgery, and they do one of two things. One, they make a big incision, pull the skin away to either side so they can visualize, and then they cut partially or completely the ligament over the nerve in the carpal tunnel. But that's pretty traumatic, so they don't do that so much anymore these days. There's a lot of arthroscopic surgery, and this isn't necessarily correct placement. I'm just making a couple holes, like they're going to make a couple incisions in your wrist somewhere, probably not right there. They're going to stick a couple metal tools in there, one with a camera at the end, and one with a cutting edge at the end, and they're going to visualize in there, poke around, and then they're going to partially or completely cut the ligament over the nerve in the carpal tunnel. And in actuality, that does in fact release any compression of the nerve that's happening right here. The trick there is, of course, the compression has to be happening right there. Otherwise, you're just going to get surgery and not a whole lot of benefit. We'll talk more about that shortly. So let's cover the four main reasons why carpal tunnel surgery might be a bad idea. The first is surgical risks, which looks like infection and nerve damage. That's spelled horribly, but work with me. So infection, they're going to cut into your skin, expose your blood, and you're in a hospital setting, which is known to have germs and bacteria and bugs of various sorts there. So infection is certainly a possibility. And if you do get an infection, then you're going to get antibiotics, and antibiotics come with their own downsides. You might even get antibiotics prophylactically, meaning they give them to you just to make sure you don't get infection. And again, antibiotics can come with their own downsides. I definitely recommend avoiding fluoroquinolone antibiotics like Cipro or Levaquin. The other risk is nerve damage. So while this picture is a little misleading because it looks all freestanding and easy access, realistically, there's connective tissue all through here at all different levels. So they have to get in there with a lot of finesse and then partially or completely sever the ligament that's over the nerve in the carpal tunnel. So admittedly, infection and nerve damage are pretty rare, but they are risks you need to be aware of, because if the doctor looks away or blinks or tremors or sneezes or coughs or just moves slightly wrong or can't see the nerve because there's connective tissue over the top of it, you might accidentally get a nick to that nerve or a nick to the major nerve. And if you don't like your symptoms now, you're not really going to like your symptoms if you get a nerve nick or cut. So again, chances are small, but they are risks you need to be aware of. If you get nerve damage, you will, in hindsight, think that surgery was a bad idea. Okay, so moving on to number two. Doctors ignore nutritional factors. Not only nutritional factors that lead to this area getting tight in the first place, but, for instance, wouldn't you feel stupid if you went through the trauma of surgery and the hassle of recovery and had little to no benefit from that, meaning you still had all or almost all the symptoms. And then later, however you found out, you discovered that all or almost all of your symptoms were from vitamin B6 deficiency. Because guess what vitamin B6 deficiency or insufficiency can cause? Yes, 100% of your carpal tunnel symptoms. So a good doctor is going to have you try out some B6 and see what happens, just as a diagnostic measure, because if your symptoms are from vitamin B6 deficiency, taking enough vitamin B6 is going to get rid of those symptoms. But good luck finding that doctor. Anyhow, my point is, wouldn't you feel dumb if you got surgery, went through the pain of that, the recovery of that, and got little to no benefits, only to discover that really it was just a vitamin B6 deficiency, which is essentially a $10 bottle of vitamin B6 could potentially get rid of all your symptoms. It's definitely worth a shot before surgery, but that's a different topic. Anywho, so doctors ignore the nutritional factors, both something obvious like B6, which can cause symptoms, but also the factors that go into the entire dynamic of muscles, connective tissue, etc., that cause the connective tissue here to get tight. Number 3, compression from other locations. And let's just pretend there's no D or E in there. So compression for other locations. Doctors generally, when they see or hear the symptoms of carpal tunnel syndrome, they're going to go, well, that is because of the carpal tunnel right there. There must be compression. That's what must be causing the compression. A good doctor is going to look a little farther abroad than that, such that, let's go down to here, such that you have the carpal tunnel here. You have the nerve come up through the forearm, through the elbow. Let's go with that's a head, a neck, and a shoulder. And the nerve comes up through the chest, shoulder, to the neck. So you can have compression of the nerve at the neck, at the chest and shoulder, more of the shoulder, and in the forearm, as well as the elbow. Essentially, you can have compression anywhere along the entire line of the nerve to the neck. A good doctor is going to investigate that. A better doctor is going to clearly identify exactly where the compression is happening, because wouldn't you feel stupid if you got surgery on your wrist, but most or all the compression was coming from the neck or the shoulder or anywhere else? Point being, if you're going to have surgery, it's important to know where exactly the compression is coming from, because surgery at the wrist is going to help compression at the neck exactly 0%. And that's a lot of why people say they have failed surgeries, is because surgery was in the wrong spot. At best, the surgery was in the wrong spot. So you have to look in places other than just at the carpal tunnel. And along those lines, the doctor never asks why the carpal tunnel gets tight, never asks why there's compression anywhere else, and never asks why this ligament specifically is tight. So they go in and do surgery, they sever that, it frees up any compression right here, which is a good thing, but then months or years later, the tightness and the symptoms comes back. And why is that? That's because there's more than one factor to carpal tunnel symptoms being caused. If the ligament does get tight, it gets tight for a reason. And here's a quick version of that reason. Essentially, tightness. So muscles, every muscle fiber has connective tissue around it. Every small bundle of muscles has connective tissue around it. So essentially, muscles are connective tissue. They attach to tendons, and you have more connective tissue, and you have connective tissue wrapping big bundles, and then you have connective tissue wrapping the entire thing. You have connective tissue in the thumb and the palm, and that connective tissue wraps intimately with muscles. So muscles that should be that length, over time, become short and tight. And when muscles are tight, they pull on the connective tissue in all directions. So when this spot is tight, it's pulling on all this connective tissue. When this spot is tight, it's pulling on all this connective tissue. When this spot is tight, it's pulling on all this connective tissue. So it's great and all to cut the carpal tunnel right there and create some freedom, but what about all this tightness here and here and here and here? Again, it's great to cause some freedom right there, but this tightness is going to continue to work over time. One of the main problems with carpal tunnel surgery is that it 100% ignores all the causative factors. So lack of nutrition is ignored, and that plays a role in this mechanism. Tightness of muscles and tightness of connective tissue all up and down the line is ignored when surgery happens just right there. Chronic inflammation gets ignored when surgery happens just right there, and chronic inflammation is happening on the entire line, essentially. Doctors just kind of hope it's going to go away. They kind of hope everything gets taken care of when they do surgery, because unfortunately doctors focus only on one spot. They don't look at the whole picture. They certainly don't look at the larger picture. So those are the 4 main reasons why carpal tunnel surgery might be a really bad idea. Infection, which usually is minor, Take antibiotics takes care of it, but antibiotics have their downsides. Nerve damage is bad news. You definitely want to avoid that. Doctors ignore nutritional factors. So if you have something like B6 deficiency causing you symptoms and you get surgery, you're not going to get the results you're looking for. Compression can come from other locations: the neck, the chest and shoulder, the forearm, the elbow, etc. Carpal tunnel surgery obviously only takes place in one spot. Ironically, you can fix the compression elsewhere, even at the carpal tunnel site, without surgery. Surgery, in my opinion, is overkill because it's not rocket science to remove compression by yourself. And along those lines, the doctor doesn't ask why the nerve gets compressed. Obviously, it gets compressed, but they don't look at the causative factors of why that is. So if you would like to find out more about carpal tunnel surgery, visit my website, tendonitisexpert.com, and visit the appropriate page.